New research is shedding light on the frequency of cannabis use in Michigan during pregnancy, and they say it highlights misconceptions about the negative health effects of the drug. 13 on your side's Elena Holland spoke to the lead researcher and an addiction specialty physician about what this means and how it could influence patient-doctor relations in the future.
New research from Michigan State University found 1 in 6 people use cannabis during pregnancy in Michigan.
And it was as high as 1 in 4 in some areas in Michigan.
That's Dr. Ban El-Sahab, the lead researcher.
Prenatal cannabis use is a growing public health issue in the United States.
This could be a problem as there are negative health outcomes for both parent and baby.
It has been shown that THC, which is the main psychoactive ingredient of cannabis, crosses the placenta and can reach fetal circulation.
Cannabis isn't benign in pregnancy.
That's Dr. Kara Poland, an addiction specialty physician. She says cannabis use during pregnancy can lead to lower birth rates, smaller babies, more congenital or structural abnormalities in the fetus, and decreased head circumference, suggesting potential impacts on brain development.
There's emerging evidence that also suggests long-term impacts on attention, memory, and behavior. And some studies also associate prenatal cannabis exposure with delays in early childhood development.
The MSU report studied more than 1,000 people recruited at their first prenatal visit. It used both self-reported data and urine toxicology to measure cannabis use.
The majority of women who use it report that they do so because it helps them with relief of nausea, vomiting, relief of anxiety, stress. It's used for pain management, for better sleep. So understanding these needs can help the provider to direct them to other safe alternatives.
Poland says Michigan has some of the most permissive cannabis regulations in the country and also some of the highest cannabis consumption rates. The state legalized recreational marijuana use in 2018.
The rates at which babies were born with known exposure to cannabis doubled starting the year before through 2 years after legalization.
With this study, researchers hope it can inform future policies, clinical practice, and research projects.
I think it underscores the importance of designing and having programs and interventions that help to reduce cannabis use during pregnancy and ultimately improve maternal and child health.
El-Sahab also said the potency of the cannabis products are much higher than they were 20 years ago. 1 in 10 people will have a hard time quitting an addiction to cannabis. There are resources right here in West Michigan to help, though. We have that information on 13onyourside.com. In studio, Elena Holland, 13 on Your Side.